Cataract surgery has come a long way over the last 100 years, but there are 15 complications that you should know about and understand. Now, some of these complications can happen during surgery, and some can happen after you've had successful cataract surgery, and some are quite serious, while others can be managed pretty easily. Hi everyone, my name is Dr. Nagori. I'm a board certified ophthalmologist, and when it comes to cataract surgery complications, I am happy to say that overall they are not very common, but it is important for you to know and understand all the risks of cataract surgery before you have cataract surgery. While cataract surgery is very low risk, it is not no risk. So today we're going to talk about the 15 potential complications that can happen during cataract surgery. If you want to stay in the know about all things related on how to keep your eyes healthy, be sure to hit subscribe, because on the iFacts.com channel, we feature not only glaucoma specialists like myself, but also other ophthalmologists that help you keep your vision healthy, as well as the skin around your eye looking youthful, and just optimizing your eye health as you age. Number 1. Non-resolving inflammation. So after cataract surgery, some inflammation is totally expected. In fact, we have post-operative eye drops that we give you to reduce that inflammation, and this is very much standard of care. Patients typically go down on the drops after several weeks, but in some cases, that inflammation can linger longer than we expect it to. In most cases, we just restart the anti-inflammatory drops and taper it down again. But if it doesn't improve that second or maybe even third time, further evaluation may be needed. And in really persistent cases where we just cannot get that eye inflammation down after surgery, again, not common, we may get a uveitis specialist involved. Complication 2 of 15 after cataract surgery is something called a posterior capsular opacification, or a PCO. Now, a PCO is the most common long-term complication after cataract surgery. When we take out your cataract, we put a lens inside the eye, and we put it into a very specific part of the eye that we call the capsule. And this capsule that holds the lens is actually very, very delicate tissue. Even though the actual lens implant stays completely intact, sometimes the tissue that is on the back of the capsule, so behind the lens but not on the lens, can start to have cells that proliferate. And this proliferation of cells can actually blur vision. Now, because this part of the eye is called the posterior capsule and it's making the vision blurry, we call it a posterior capsular opacification, or a PCO. The good news is treatment for a PCO is very, very simple and painless. Now, your ophthalmologist will use a laser to restore your vision, and the procedure itself only takes a minute or 2 minutes, but you do typically need the pupil to be slightly dilated, so that can take about 30 minutes before you actually have the YAG laser procedure done. Now, this laser is typically done by the ophthalmologist that also did your cataract surgery. Now, if you've changed locations or moved since your cataract surgery, just be sure to find another board-certified ophthalmologist who can do the laser for you. Number 3 is a complication that can happen during cataract surgery, and this is something called posterior capsular rupture and vitreous loss. This complication can happen during the surgery, and it is a little bit more common when the surgeon is creating something called the capsulotomy. And the reason the surgeon does this is they want to access the lens that they want to then take out. Now, sometimes this procedure can be a little tricky, especially if the iris is not behaving or if the eye is damaged in other ways from previous trauma. But basically, if this happens, surgeons will identify it quickly by observing changes in the lens position or how the front of the eye looks, and we call this the anterior chamber depth. Now, risk factors for having this complication include small pupils, really hard cataracts, and something called pseudoexfoliation glaucoma, as well as having previous retinal surgery or something called high myopia. If this happens, the situation is handled during surgery through another procedure called an anterior vitrectomy. Now let's get into complication number 4 of 15, which can happen after surgery. After cataract surgery, CME or cystoid macular edema is one of the most frequent causes of blurred vision after a seemingly uncomplicated surgery. It can kind of show up 6 to 8 to 10 weeks after surgery, and it's because there is some edema, which is swelling in the back of the eye where the macula is, and the macula is a central part of the retina. The diagnosis is made by looking at the back of the eye as well as using a special test called an OCT. Now, CME is treated usually with anti-inflammatory eye drops, and in some cases, if needed, an eye injection. Now, most cases will resolve with proper treatment, but untreated CME can cause long-lasting visual complications. So if you feel like your vision is blurry after cataract surgery, it's important to go in and get seen by your eye doctor. Number 5 of 15 is something called endophthalmitis. Now, unfortunately, endophthalmitis is pretty much a cataract surgeon's nightmare. It is a rare but very severe infection that happens after cataract surgery, and the symptoms can include severe pain, redness, sudden vision loss, and just a painful eye. Overall, this infection is very rare, but if a patient has poor eyelid hygiene, blocked tear ducts, or they are much older, this does increase the risk of endophthalmitis. Treating endophthalmitis very quickly is important, and this is typically done through injecting antibiotics into the eye. Typically, the patient will also need to have a surgery as well, in addition to antibiotics. So again, if you experience pain or redness or something really concerning, it's always important to talk to your eye doctor because they are the ones that can diagnose this vision-threatening infection. Overall, having this type of infection is extremely uncommon after cataract surgery, but it's important to know that if you have a red, painful eye after surgery, get it checked by your eye doctor. Number 6 of 15 complications of cataract surgery is bleeding. So bleeding inside the eye, something called a vitreous hemorrhage, is rare, but it can happen, especially if patients have something like high blood pressure, diabetes, glaucoma, or some vascular disease. If you experience vision loss after surgery, that could be a warning sign. So be sure to, again, go in to see your eye doctor if you are concerned with a decrease in vision after cataract surgery. Number 7 is something called a retinal tear or a retinal detachment. Retinal detachments can be delayed but serious complications, and in some patients, they can actually occur weeks or even months after surgery, especially in patients who have something called high myopia, which means they have a highly negative eye prescription. And if they have pre-existing retinal disease, this can also increase the risk. Again, as I've said before, early detection and prompt repair of the retinal tear and retinal detachment are very important to keeping your vision after cataract surgery. This is, again, a fairly uncommon complication, but it can happen. So it's important to understand what to look for, which could be sudden onset flashes, floaters, or any kind of curtain coming over the vision or something that's decreasing the vision. And if you're not sure, just go in and get checked. Number 8 of 15 complications after cataract surgery is lens dislocation. Now, this is pretty uncommon, and the intraocular lens can shift a little bit inside the capsule, but it typically does not shift a lot. But if you have some kind of trauma, you can have a lens that shifts outside of the capsule or to a different part of the eye. Treatment would involve surgical repositioning of the lens and replacement if needed. Number 9 is a strange complication. One of the weird and unfortunate things that could happen during cataract surgery, again, not common, but it could happen, is getting the wrong intraocular lens placed in the eye. So when the cataract surgeon plans to do your surgery, they are measuring what lens to put in the eye that's going to replace the natural lens of your eye that they are going to remove during cataract surgery. This lens is properly fitted to your eye's measurements so that you can see a certain distance. Now, if that lens is by accident switched out with another patient's lens that day, that could result in a visual outcome that they were not expecting. So if they gave you a lens that is supposed to see 20/20 at distance, but actually put in the wrong lens, it could be that you're not seeing 20/20 at distance, and you may need to actually have the lens exchanged. Now, depending on how off the new lens is from the originally planned lens, there is a possibility that a laser could be done afterwards to actually correct the eye's vision so that it sees the way it was intended to see. But this all depends on the specific measurements of the eye. Going back to the operating room to do a lens exchange is not a small surgery. So in cases where we could do a laser to actually correct the vision, that would be a better option. But if it is noticed very quickly, then the patient may be able to go back to the operating room that day to have the lens replaced right away. Number 10 is something that is not as complicated, and this is having an eye pressure spike. So having a temporary eye pressure spike after cataract surgery is not very uncommon, and it actually will just resolve on its own as the eye begins to heal. Now, if it is very high, it may need to be managed with eye pressure lowering drops for a very short period of time. There are some cases where when the steroid drops are used after cataract surgery to help reduce eye inflammation that we mentioned earlier in this video, that those steroid drops could actually cause the eye pressure spike. And in that case, sometimes going down on the steroid can actually help deal with the eye pressure. Number 11 of the 15 complications you need to know about cataract surgery is having something called a retained lens fragment. A retained lens fragment is a fairly uncommon complication of cataract surgery, and this is when a small piece of the cataract actually stays in the eye after surgery. And one of the ways that we notice it is that the eye may have prolonged inflammation after surgery. Now, this type of small fragment that's been sort of left behind after surgery, if it is small, it can actually just dissolve without any intervention at all. But the larger ones might actually need a small surgical procedure to just go in and extract that piece of lens. Number 12 of 15 complications to know is something called a corneal wound leak. Now, most cataract surgery incisions are actually self-sealing and they do not require stitches in most cases. But if a wound is not as secure as you expect it to be, a small leak can happen after surgery. So if a surgeon suspects this, they may use a bandaged contact lens to help seal the area, or in rare cases, they may need to go back and place a suture to help secure the wound. Number 13 of 15 cataract surgery complications you need to know about is having something called ptosis, or a drooping of the eyelid. Now, after cataract surgery, you could have just a mild drooping of the upper eyelid, and it will typically just resolve. It's usually from the pressure of the surgical instruments that you've had to keep the eye open during surgery, or maybe related to some of the anesthesia that you got. Now, for most patients, this sort of droopiness will actually resolve on its own, but if it is unresolving, you may need to see someone called an oculoplastic specialist to help resolve the issue. Number 14 of 15 complications that you need to know is corneal edema, or swelling of the cornea. Now, after cataract surgery, we expect some mild swelling of the cornea, and this is typically going to resolve within a few days or weeks. But in some patients who have corneal disease, such as Fuchs dystrophy, swelling can be more severe or persistent. Also, if patients have waited a really, really long time to have cataract surgery, then the energy required to actually remove that cataract may be higher than someone who, let's say, had cataract surgery when the cataract was only mild to moderate. And in those cases, that extra energy that's required to take the cataract out can also cause a little bit of additional swelling. Treating this in the beginning typically involves using a hypertonic saline drop to help draw the fluid out and reduce the swelling. But if there is a case that is just not responding to conservative management, your doctor may recommend that you see someone called a cornea specialist. And the last complication you should know about is something called a refractive surprise. Now, a refractive surprise is not a good thing after cataract surgery. It is not a good surprise. A refractive surprise occurs when the vision after surgery is different than what the surgeon had planned, even though the correct lens was actually placed in the eye. So before surgery, your surgeon will select an eye lens power that is based on the precise measurement of your eye and your visual goals. What do you want to see after surgery? Do you want to see at far? Do you want to see at near? Do you want to see all ranges of distances? And sometimes, despite taking accurate measurements, using the right intraocular lens, having an uncomplicated surgery, sometimes you can still get a refractive surprise. Now, when the final outcome does not match the surgical prediction, then you could use glasses to help get you back to where you need to be, or a minor laser adjustment to help adjust your vision to exactly where you want it to be. Now, the good news is that this does not actually affect the health of the eye, and the vision can be correctable in other ways. Complications from cataract surgery can happen, but remember that they are usually uncommon and very manageable, and understanding the possibilities of what can happen during cataract surgery is really important important for patients so that they know what to look for after cataract surgery and when they need to engage their doctor. What questions do you have about cataract surgery? Drop them in the comments below and I'll do my best to answer them in a future video. Hope you found this helpful. Remember to hit like and subscribe, and I'll see you in the next video.